doktor, pero iba-iba din sila. Meron tayong iba-iba yung mga tao na nagtatrabaho sa Doctors Without Borders from the Philippines. Meron tayong engineers, meron tayong finance people, meron tayong comms people, not just me. Tapos meron tayong nurses, meron tayong HR. So we're going to hear a little bit of these today. And so we're going to start with Ann Jimenez. Okay, so she's our senior field HR officer. Okay, she's our field human resources officer in MSF Hong Kong.
Hi, Reg. How do I sound?
We can hear you loud and clear.
Okay, good. That's good. Hello, everybody. Maayong hapon sa tanan. My name is Ann Jimenez, and my profile is a nurse. But my field of specialty is operating room nurse. I've been with MSF for the last 10 years, going 11 this year. And 10 years of that I spent as a field worker or international mobile staff in different countries, Africa, Middle East, and even Asia. So I was asked here by Reg to talk about a little bit about my journey with MSF. Paano ko ba nalaman yung MSF? To be honest, way back in the early 2000s, I saw this documentary on National Geographic showing a doctor who is doing surgery under a tent and it was raining. Sobrang ulan. And apparently it's Médecins Sans Frontières, yung French name namin, in Doctors Without Borders. Now this had an impact on me kasi ang field ko, I was looking into going really deeply into operating theaters or operating rooms sa Philippines. That time I was a professor. I was teaching in Far Eastern University in the Institute of Nursing. So malayo sa mind ko. Also another reason why I didn't apply then because I am a single mom. I have one daughter and I was thinking more of her of putting something on the table and sending her to a good school. So medyo tinabi ko muna yung aking desire of working for a humanitarian organization. And then when I was working in UK, I noticed na yung ibang mga kasama ko, yung mga ibang colleagues ko who are British, were volunteering for these two big British NGOs in UK. So some of them were going to Afghanistan, some of them were going to Africa. And this is so because yung kind of employment sa UK, if you are a citizen, if you've been working in the hospital for a long time, you're allowed to do long leaves, no? So when that is given to you, syempre gusto mo. So many of them were taking leaves for 3 months, just volunteering in Afghanistan, for instance, or somewhere in the Middle East. I wanted to do that. So what did I do? Ping MSF came into my mind. I Googled MSF to find out if there's an office in London. And apparently there is. There's one in Regent Street in downtown London. So I called. Unfortunately, they said, but you are not yet qualified simply because you are a permanent resident. You are not a citizen. So I do not have this opportunity na kasi nagli-leave sila kahit 3 months, kahit 6 months. When they come back to UK, they still have the position, which is very rare in the other country that I used to work with. And so hindi ako qualified. So okay, down again. Roll 2011, my daughter graduated from college. So I thought matagal na ako. It's been a while since I've been home with her. I've been working outside of the country for the most part of her teenager life. So I decided I will stay and be with her because now she's a graduate. Even before she graduated, she already had a job offer in one of the Chinese school in San Juan. So I was happy for her. So I was really wanting to retire at that time. Then again, bumalik na naman sa isip ko, hindi ko alam if do I want to go back to academe? Do I want to teach again? Do I want to go back to hospital? Sabi ko, I don't think I can do this shifting anymore, this day, mid, and night shift anymore. So again, bumalik sa isip ko yung MSF. What did I do? I googled MSF again, and I have to find out how to be a part of the organization. Next slide, please. Next slide. Back one year. If you will go in Google this the website for MSF, you will find, if you Google MSF careers, you will find this. So this particular part of the website will tell you who we need. So it will also tell you, na yung sinabi ni Reg, it is not only doctor. It's sort of like a misnomer. Doctors Without Borders will not run without the other people who are part of the framework of the whole organization. Logistics, for instance, admin, finance, and everybody else, medical, paramedical, pharmacists, etc. So in this particular site, you will find out who we need, and also it will also take you how the recruitment process will be. All of this essential criteria. Well, let me just mention about this essential criteria that uh, we absolutely need at least 2 years of experience. So after you graduate, maybe get 2 years of experience, then you can apply with MSF. And then compensation and benefits, security, etc. All of this will be discussed later on by our HR director. So I think she's the one who's really the person to talk about this particular um, part of MSF recruitment. So then again, so I applied. I applied with MSF, and then 2 weeks later, somebody was calling me over the phone. It was an overseas call from Hong Kong. Already, I said, like, oh my God. So she interviewed me because at that time there was no such thing as Zoom, there is no such thing as Viber, WhatsApp, whatever. So we started conversing on the phone. It took us about 45 minutes of conversing. And after that call, I was not sure of myself. I don't know if I said the right things or okay, forget it. If it's going to happen, it will happen. And true enough, 2 weeks later, I got an email from them saying that they're going to hold an assessment center here in Manila. So I was invited if I can join them. So I did. Uh, that's another soul story of assessment. All right. So I did the assessment with all the other applicants, and after that, I thought it's done, and I'm not yet sure if I did it, if I made it to MSF. And then, oh, lo and behold, I got an email from Hong Kong saying that they are accepting my application. So that was a big hit for me. And a few days later, I got an offer immediately from my career manager in Hong Kong. So then I packed my bags. Next slide, please. Thank you. This is a picture I like to post a lot, especially when I go for a mission. I'm not saying where I'm going, but I'm just saying I'm packed, I'm ready to go as always. So where was my first mission? This is I have four very, very important, very, very memorable experiences with MSF. Of course, you cannot discount the first mission always, no? Ang first mission ko was in Sierra Leone. Okay, Sierra Leone. Africa, West Africa. Of course, the first thing I did was, right, I Googled it. What's all the things I want to know about Sierra Leone. So I learned that it's in West Africa. So, you have North Africa, East, West, and then South Africa. And Sierra Leone is that small, small dot on the lower left, bordering Guinea and Liberia. It's that very small dot, the green, light yellow, I think, down there. So it's a very, very small country. And I wanted to know more about Sierra Leone. So I Googled still. The first thing I wanted to know was, is there electricity? Because I have this thing in mind that Africa is very difficult. I was one of those medyo, medyo sintonado yung pag-iisip. So, I wanted to know kung may kuryente. Number two, may internet ba? Kamusta yung mga tao? Kamusta yung... I have all these questions in my mind that I needed to answer. But I already said yes. I already said yes. And I was just preparing myself. And I'm always like that. After this first mission, I'm always like that. I Google, I research, I wanted to be informed, apart from the fact that I will be informed by MSF themselves. So off I went to Sierra Leone. But before I went to Sierra Leone, I did a briefing with Brussels. One of the very important briefings that I got in Brussels was infection control. And before everybody in the Philippines knew about this PPE, we were already wearing it in Sierra Leone, and you will know later why. So let me give you a brief rundown on what Sierra Leone is all about. The capital of Sierra Leone is Freetown. When you arrive in Sierra Leone, it's like Boracay, no? You land in Lungdi Airport and you'll ride a small motorboat going to Freetown itself, downtown Freetown. So it's a very small country bordered by Guinea and Liberia. This is the reason why Ebola spread very fast in Sierra Leone because it is connected by land, Liberia and Guinea. You know, with that in 2014, Ebola started in Guinea and then it spread fast to Sierra Leone and Liberia as well. So many people died during that time. It was difficult to control in the beginning because people were traveling by land. So that's how it spread. The project that I was in Sierra Leone was in Bo. Bo is the second biggest city after Freetown in Sierra Leone. And the hospital that I work for, which is a standalone hospital, is Gondama Referral Center. I say standalone because there are two types of hospital that we support. One is MOH or DOH hospital, just like San Lazaro, where we collaborate with the people in the hospital. And number two, you have the MSF standalone, which is built by MSF, run by MSF, and all the staff are hired by MSF. So with this one in Sierra Leone, it's Gondama Referral Center. They did not change the name anymore. The history of this hospital really is because um, during that time in the civil war between in Liberia, people were coming inside Sierra Leone. So they built a refugee camp right in front of this hospital. And there was a refugee camp full of Liberians, also IDPs from Sierra Leone who were victims of the civil war. And then they built this hospital for them, for the refugees, basically. And we kept them. Now it became, when I arrived, it was a pediatric hospital already, plus maternity hospital also. So this hospital is quite big. It is a 120 bed capacity hospital with 8 wards, 80 plus nurses. I was the nurse supervisor of the 80 plus nurses plus nursing aides. So you can imagine the bulk. And this is the first time I handled that big number and that big number of people, nurses and nursing aides. And this is my first mission. So you can imagine a little bit traumatizing for me, but in the end, it went okay. Okay, I talked about PPE earlier. This is the reason why. Lassa fever is a hemorrhagic disease similar to Ebola. But this one, it's coming from the mouse, the urine and fecal matter of the mouse. And this is very, very dominant. There are a lot of people in Sierra Leone having this. And this is also deadly. Well, not as deadly as the Ebola, but it can kill you. Once you have it and it's too late to give the antibiotics, it cannot be saved and people will die. There is a hospital in Sierra Leone, in Bo, near Bo. It's Kenema Hospital who takes care of this patient. So when we identify patients with Lassa fever, we bring them to Kenema when they are uh, deemed to be positive of Lassa fever. So kailan namin sinusuot yung PPE? We wear the PPE when we take care of the patients. We take the blood samples, just like what you see in COVID as well. We take the blood samples, we feed them, we take their vital signs, etc. So every now and then you will see people in that PPE as well. So this is nothing new with MSF. With especially everybody's talking about the N95. We've been using it like way back. Okay, so the project I was in, I was there for supposedly 9 months. I extended a bit because I have nobody to carry over the work that I'm supposed. I have nobody to hand over, so I stayed a bit as well. So 11 months. Imagine first mission, 11 months. It was tiring, but it was a good experience. And this made me more. I was thinking like a short term mission with MSF, maybe like I will just try it once. But this particular mission, this particular experience gave me a lot of courage to get to another mission after Sierra Leone. So just to show you a little bit of the picture for of Sierra Leone as well. Move over to the next, yes. This one is one of our ambulances. We have a lot of ambulances. Since we are a referral hospital, we get patients from, kumbaga sa atin, barangays. No? Yung mga inner barangays. And we bring them to where the hospital is. So we use this kind of cars. This one in particular, Bravo 50, is for specifically for Lassa fever suspicious patient, no. So panglasa lang to. Meron kaming other ambulances that also is used for other patients, no, malaria, etc. So for this one, it's just for Lassa fever. And funny, I like to take a picture of this because this is one uh car that nobody wants to get in. The patients, the staff, even they don't want to get in that car because of the stigma of this Lassa fever that's happening in Sierra Leone. Thank you. Next slide, please. If you can see the picture on your right, is that this is the road that we have to take every day. From the town going to the hospital, this is the kind of road that we take, especially when it's raining. So it's like a roller coaster. It's an up and down thing, and it's full of water. And that is the reason why the favorite car of MSF, and not only MSF, I think other NGOs as well, is the Land Cruiser hardtop that we use a lot in all the projects, almost all the projects that in Africa and in other countries as well. So imagine 30 minutes of this roller coaster every single day. Next slide, please. Next slide, please. Reg. Next slide. Thank you. Now, this is the facade of the Hospital Gondama Referral Center. The picture down there is inside the hospital. If you notice, they look like houses. It is the same almost in every African countries that I've been to. They don't build one whole building. No, it's not like in the Philippines and in some other countries that our hospitals are built as one. No, so it's interconnected with just one building. In Africa, it is not. Every single department is separate from each other. Maybe the reason behind that is they started with one. Maybe they started with ER and one ward, and then they decided to move on and make more buildings like that. So on top of our everyday activities in GRC, so we have patients who have severe malaria, snake bites, etc. We also have the picture up there on the top right is ITFC ward, no? Inpatient therapeutic feeding center, meaning we have determined a lot of undernourished children in that area. So they bring them there as well. So every day there is a schedule for them to feed the babies. We don't give them the milk. There is a certain percentage of how much milk they're supposed to drink. We watch them feed the baby every day. 3 times a day, or sometimes even 5 times a day. So the one in front, standing in front of them, is a clinical officer. While they are feeding the baby, he is also trying to give them health advices about taking care of their babies. And okay, the picture beneath is a baby I'm holding. It's a baby of a staff. I told you, we have a maternity department as well. So we do deliver babies in normally, and we also do a cesarean sections for them. Okay, next picture. Oh, wait. Before you go to the next, okay, now you're there. It's okay. It's okay. Go to the next one. And now, moving forward to another memorable experience for me was in Yemen. I was in Yemen like 4 times. So I was in four different areas, and my last international mission was in Yemen as well. So as you know, Yemen is in war. Uh, with the Saudi coalition. And during the time I was sent there, it was the most difficult time. It was April 2015. They started bombing heavily March 2015. So you can just imagine us. It's my first ever mission of having experience kung ano ba yung pagbomba, no? Kung ano yung feeling ng binobomba ka. Um, in fact, my family was against this decision of mine, but I wanted to do this. Sabi nga nila, we like to live our lives dangerously. But well, I wanted to go. So in the end, ako pa rin ang nanalo, no? So yes, the capital of Yemen is Sana'a. Still, Yemen is in war. Although meron silang konting katahimikan happening since April, but still hindi pa siya na re-resolve until now. So I was in Sada City. This is the northern part of Yemen, at ito yung pinakamahigpit ang culture, because the Houthis, sila yung mga rebelde, sabi nila sa Yemen, they are all from Sada City. So yung mga Houthi is a name of the leader. All right. So I was in Sada City, Abs and Hajjah. But I think the most difficult for me is Sada, because I was a NAM, nurse activity manager for OT. So you can imagine, we are at war. Maybe no bomba every day, no? Walang war, walang ground gunfire, walang ganon, bullet fires, wala. They're all bomb related. So you can imagine, dadating yung pasyente sa'yo with a traumatic amputation of a leg, both legs, open abdomen, or walang kamay, all because of the bombing. And they're coming in crazy because pag binomba yung isang lugar, sometimes they come to you in bulk, no? They come to you like 8, 10, 12, 20. The most difficult, we call that mass casualty in MSF, and we are always prepared for this, especially in projects like this ang context, no? So ang pinaka maraming numbers that we got for one day was 42, if I'm not mistaken, and 22 of those went to OT on the same day. So walang tigil yung OR team ko. They were working. They were really, I even have to call extra people to lend a hand when there is mass casualty. Um, until now, medyo tahimik sila ngayon, but doesn't necessarily mean the war is over, no? It's not. So, uh, well, yeah, hanggang ngayon, I'm still praying for the people there. My last mission actually was in Hajjah in 2019. It's a hospital that I was sort of like a ma'am and a nam. I was in charge of MOH, the Ministry of Health personnel who are under MSF incentive. So, dadalawa lang ang MSF dun sa staff. All the rest of the supervisors, like 12 of them, they're all MOH. And I was really very happy with the kind of culture Yemen has. It's more of patriarchal, no? So medyo ang male sa kanila medyo stronger. than the female. So I was really very glad that they accepted me. Even dun sa Sada, when we were in the OT, I had 28 staff. All of them were male. I was the only female there. Okay. So from Sanaa, the capital, the projects that we used to go to, all of those that I mentioned, Sara, Abs, and Hajjah, they're about 45 hours away from the capital. So you have to travel with all the checkpoints and everything. Sirang tulay, binomba yung kalye. So all of this stuff with security naman. We always ask permission. We always ask permission before we do the movements in Yemen, especially. All right. Next picture, please. Just to show you a bit of what it is, what it looks like in Sada. Sada is like a barren land, no? Yung pag iniisip mo yung Middle East, ganyan ang itsura niya. When it's like summer. But when it starts to rain, green yan. The things around the tree strands, the trees starts to become green, everything becomes green, but the houses are like that. They're made of mud, they're made of limestones, and it's really cool inside. Believe it or not, some you don't need an AC even pag nasa loob ka ng ganyang klaseng bahay. It's quite cool. And if you see the mountain from afar there, you will see that from here. Yun ang Saudi Arabia. So you can imagine, palaging tinatamaan ng Sada at yung the same thing, Sada is also fighting papunta dun sa kabilang side na yon, which is Saudi Arabia. Okay, next picture, please. All right. So I said in Sada, I was the NAM for OT. So I am in charge of 28 people, surgeons, nurses, and anesthetists. Meron din kami mga expats or international mobile staff na surgeons who are helping us, who train the other surgeons as well how to do it the MSF way, because we have certain protocols in MSF, so we can practice it here kasi 100% MSF kami dyan sa loob ng OT. So me as a manager, I'm supposed to be just behind them, but sometimes I cannot help myself. No? I want to put my hands in there. So I also help, especially when there are multiple, like, alam nyo na, pagka bomba, it can hit you anywhere. So sometimes multiple injuries yan. Somebody's doing surgery up there, somebody's doing surgery down here. So I help the scrub nurse also para hindi naman siya mahirapan na dalawang surgeons ang ina-assist niya. So I scrub with them as well because this is what I love to do. This is me, OT. So despite of the fact na, let's say, ugliness of the war, you can see it everywhere in Yemen. There are still places there that are still beautiful. Go to the next picture, please. Thank you. This is a real picture. I took this picture myself. This is outside my window in Hajjah. Hajjah is a place on top of the mountain. So we living inside the hospital. The hospital is inside. The hospital is on top of the mountain, and this is my view every single morning. Beautiful, no? When you look at it as if it's so serene, like there is no war happening. They're not affected much in this area, though, I can say. That's why the buildings are still intact. But yes, we are getting patients from outside, from the front lines. They bring them to us here in Hajjah. So we still see the amputations and all those stuff that we have to do in OR and in ER as well. So beautiful Yemen. Thank you. Now important. My next memorable experience would be the COVID-19 intervention that we did. During the height of the COVID in 2020, around April, MSF decided to do an expo on which hospital we wanted to intervene, but where? That is the question. So we had people coming in uh, to do the expo and decided we will support San Lazaro Hospital. So for those of you who have been to Manila and who are in Manila also, and who have been a student before here in Manila, you know that you will do a rotation in San Lazaro. It's it's the appointed hospital for communicable diseases. Basically, they have patients there with rabies, tetanus, measles that are complicated, TB, HIV, all of those diseases that are communicable. They have it in San Lazaro. So what did we do in San Lazaro? So they decided San Lazaro. Tried recruiting some people to do the work for us. We promised them this number of, but we didn't quite uh, fulfill it because we didn't get a lot of applicants that time. Everybody was afraid of the COVID. I was afraid of the COVID, but most of our applicants were coming from outside Manila. Believe it or not, they're coming from the provinces, Mindanao and northern Luzon and the Visayas. We had to fly them in because they are the only ones willing to work, and they already knew where they are going to work beforehand. So MSF agreed that we are going to support the COVID intervention through medicines, equipments, and HR to San Lazaro Hospital. If you are watching TV every day, you'll see Dr. Rogin Solante. He was our direct boss. So we were also under him, like all the rest of the staff of the adult ward. Okay, so we were working closely with him. What he say, we follow. So we had about 28 staff assigned in the COVID ward. Mainly, they are doctors, there are nurses, there are registered medical technologists. We also had encoders because this is the reason why one of the reasons why the delay of the what do you call this, the results of RT-PCR that time. They don't have a lot of encoders to encode it, not a lot of registered medical technologists to do it, and also cleaners. All right. With this is what they wanted us to bring, so we brought them some of these people. We couldn't fulfill the number that they wanted because we couldn't get the number of people applicants really. So if we try to interview them and we bring them to the hospital one day just to try it, uh, believe it or not, they will back out because of the fear. Okay, but I salute this 28 staff who stuck with us until the end. So and one thing that I'm very proud is nobody with the staff got COVID. They some of them I heard they got COVID after our MSF intervention in San Lazaro, but never during the time because we try to provide them with the maximum. We monitor them every day. We put them in one house, in one hotel, all of them, so that they will be going just to the workplace, to the hospital, and then back again. We provided them laundry assistance and all the things that you can imagine to protect them from COVID as well. So cleaners, why do you think cleaners is important? Again, infection control. This has been pointed out by DOH also, and this is also very important with MSF. We have a certain protocol for cleaning, and the cleaners in that hospital were not very keen in cleaning very well because they are afraid of contracting the disease. So we made sure that we train these cleaners very well how to clean it, use the ones that we're using in the projects, and it went very well. No problem at all after that. The project lasted for 6 months, including the time that they did the the what do you call this, the including the time when they started to scout for the hospital that we want to support. And the MOA, or the memorandum of agreement with SLH, also lasted for 6 months. All right, so we are gonna browse now with the pictures next. Okay, this is one of the wards. uh One thing that I noted in that hospital is normally they would have patients who have measles, complicated measles, for instance, which is communicable, rabies, tetanus patients, diphtheria, and all those stuff they bring to. Surprisingly, at that time, there were no patients like that. People were not going to the hospital. They were afraid. So we have all these other wards vacant. We converted it to COVID wards anyway because we were having many patients at that time. At one point, staff were also getting sick, so they maximized the use of our own staff at that particular time. So I guess now it's much better. So people are coming back to the hospital to have themselves seen by specialists as well. So just the last picture for this COVID team. This is the whole team. This is right in the square in front of the hospital. So these people are really very good. They did a job well done for everyone, the doctors, the MDs, the RNs, and the cleaners even. Huh? I salute these cleaners very well. All right, my last memorable experience with MSF would be Typhoon Odette. This happened in December of last year. So sometime December, the MSF sent an Explo team to uh, to that part of Surigao del Norte and then to Dinagat Islands. So everybody was putting all the help mainly in Surigao and Siargao. A lot of people were doing stuff already there when we did our Explo. So it was decided that we will concentrate ourselves with Dinagat Island. So the project Dinagat Island, in Project Dinagat Island, we agree that we're going to do mobile clinic in the outer outlying shorelines, because it's an island and there are barangays going around the island like that. And two ways to travel. We travel by land with cars, I mean 4x4s, and then we also travel by boat. So we have a boat. We have a sea ambulance, in fact, we call it, to go to those areas. So what did we agree to do? We agreed to support also, apart from the mobile clinic, we agreed to support also two identified hospitals, two secondary hospitals in Dinagat. So HR support only for that. So in the end, we also donated something for them. But in HR support, we decided that the whole team will be cut into, like, we are like 18. So we cut them into two, and then part of them will go to the hospital every day. Part of them will go to the mobile clinic by boat every day, and then they exchange. They exchange. So everybody will have the experience as well. So apart from the HR support that we identified for the hospitals, we also did distribution of non-food items, mainly like towels, pots and pans. We also distributed construction materials for them to at least temporarily repair their homes and things like that. In the end, we did a donation of medicines and hygiene kits, even to Shargawa. So it's just not Dinagat for the donation. We also did some donation in Siargao. So we are about 18 staff in the project, including four doctors, three doctors, I think, and a couple of us nurses. And logistics very important for emergency missions like this. The mission run for about 2 months only. We finished in March. Dahil nung time na yon, ang dami ng NGOs din na dumating, local and international NGOs na dumarating na din. So I think when we see that, when MSF see that, usually we try to veer away already because we know that the government, the LGUs have the capacity, and then marami ring NGOs na nagdo-donate din sa kanila. So at the end of the project, we decided we will donate a certain amount of materials, a certain amount of medicines to the operation center in Dinagat, and that's what we did in the end. Next picture, please. Okay, just this is just a very fast view of what Dinagat Island looks like. No, it's directly in front of Surigao, and you can only cross to Dinagat to San Jose by boat. No, so every single time we go out of Dinagat, we go to Agusan, say for instance, or we go to Surigao. We have to cross by boat. It's about an hour ride, if it's not a Roro. If it's a Roro, it's 2 hours because Roro is heavy. So, okay. When we arrived in Dinagat, we saw this kind of pictures. The next slide, please. This is what we saw. Basically, the main source of income in Dinagat is fishing. Apart from fishing, it's also boat taxi, as they call it. No? Since it's an island, ginagamit nila yung boats like a taxi to go around. Mind you, Dinagat Island is not just an island, no? It's a rolling hill and mountain terrain. So even in the capital, sa San Jose City, paakyat baba yan. So walang straight halos na road that you can travel. So the point of having this boat taxis is pwede silang umikot, mas madali sa kanila instead of going up and down the Dinagat mountains that they have. So when we arrive, this is the port of San Jose, which is the capital. So you will see that the boats are destroyed. The houses are been temporarily repaired already, some of them, but still some of them were not prepared. So sira ang kanilang pamumuhay. There were no means of living. Kahit na yung ibang hindi nasira yung boat, they have no fish. Parang sabi nila, if I'm not mistaken, the fish were driven away because of the lumayo, pumuntang Surigao, yung mga isda because of the lakas ng waves ng water and because of the turbulence maybe caused by the typhoon. So it took some time. Bago kami umalis, the fish were already coming back, and that's a nice thing to see. And some of these houses were also rebuilt during the time that we left. Okay, just to show you another picture of how the impact of Typhoon Odette. Next picture, please. In the mobile clinics that we do, we go to the health centers. If you will see the anong similarity ng dalawang pictures, and these are two different places. Pareho silang walang bubong. And this is true with all the barangay health centers, barangay offices, even the houses. No, wala silang bubong. So, maswerte ka if you have a first floor. Kahit papaano you have something above your head. But kung hindi, that's the main problem because you have to go to like a facility where sama-sama kayo doon, no? So medyo nagkatagid-tagilid yung COVID issue dito that time because of the impact of Typhoon Odette. So it was really sad that ganito yung ano, and during that time, believe it or not, it was also raining. So papasok kami sa loob but it was still pouring from up there. So difficult times during that time. And it was difficult for us, much more with the people who are living in those barangays. We did about like, if I'm not mistaken, about 15 to 16 barangays all in all. We did the mobile clinic. Next, please. The activities that we do basically in the when we do a mobile clinic, we have doctors to assess patients, no, to do consultations with, and this is what the picture on the right is showing you. The one in blue standing with a man is a doctor. She's trying to check this man. Usually the cases here are ubo, sipon, the normal things that you would see. Some of them would also need wound dressing coming from because of the Odette, and some of them are hypertensive. I think this is something from before already, but we also provide consultations for them. On top of that, we also give them medication. So after consultation, the activity is the doctor will write a prescription for the patient and will go to me, the one on the top left, and I will give them the medications. How do I give the medications? Depends on how many days the doctor will say. Say for example, 14 days, I'll give them enough for 14 days. If they say if it's for a month, then I will give them enough for 1 month. And that is our commitment for them. And after that, we will uh, they will have to get it from the LGU because the donations will now go to the LGU after our mission. Also with that, not to forget that this is a traumatic experience for everybody in that island. So we also have mental health happening at the same time. So we have two people assigned to do mental health. One is for children, like a get together for children. They want to talk about, they let them draw, they let them color things. And we also have sessions for adults as well. So this is also happening together with a medical consultation that's happening during that time. So meron kaming mental health consultations as well. All right, next, please. So I said that we almost always separate into two groups every day before we do our job. So part of us will go to the hospital. I'm usually in the hospital with different with my colleagues over here. So we help them in terms of it because some of them have not returned yet to their jobs at that time. Some of the staff have not returned. So kulang sila sa staff talaga. So we give them a hand. Meron kaming mga nurses to help them with the medications, to give an IV. We also have a midwife on the left. She was a very big help kasi despite of it all, marami pa ring nanganganak, no? So, iisa lang ang kanilang midwife doon sa hospital na yun. So, she was really a big help. In fact, they requested her to stay but could not. So apart from this, we also have a doctor assigned every day with us to para i-empower naman yung doctor din na nandoon. Sometimes the doctors are there already 24 hours. So what MSF can do, the doctors can do is to help them checking the patients, doing the rounds with the doctor, and so on and so forth. So every day, ganito yung gawa namin. At the end of the day, we always do debriefing with everybody else. What experiences do you have? What did you notice? Maybe we can improve this, or what rather, what can we improve in our services, etc. All right. Next picture, please. I mentioned distribution of NFIs. That is a boat I was talking about. It's a sea ambulance, but we also use it for delivering some heavy equipment, rather heavy things like NFIs. It comes in barrels, so materials such as nails, foams, whatever. So we use the boat to go around the places. It's much more difficult to get a truck and put them all. But in some places where it's really very difficult to use the boat, we use the trucks instead. So most of the time it's like this. So this is turned over to the barangay captain usually, and the barangay captain is in charge. He has a list, and the barangay captain is in charge of distributing it to the people. They need to have uh, a way of doing this. We cannot just hand it over to the barangay, naman, alam mo na what will happen. Sometimes, I'm not saying it always happens, but it does. So we try to avoid that. We have to make a system of doing this as well. So during the weekends, we get together, all of us. Next picture, please. And we also do our mobile clinic, island mobile clinic. The whole of the team will go to a particular island. This particular one is in Puerto Princesa. Anong una akala ko Puerto Princesa, Palawan. Ang layo naman ng tatahakin natin. No, apparently Puerto Princesa, Dinagat. No, so this is a separate island altogether from Dinagat. It's quite big. The population is also big, and everything there is destroyed. The electricity is down. So one of the things that MSF donated to them is a generator as well, and a pump, I think, for the water because main problems nila doon. So we did twice a mobile clinic for this community. Very receptive sila. They all came in bunches. Ang dami nila. So we were really very happy. Almost kala na halos na ubos yung dala naming gamot just for them. No, so this was a very good experience for everyone. Enjoyable, in fact, sama-sama kami in one boat, and then also completing din dahil at the end of the day nakatulong ka sa maraming tao. So, despite of this all na nakita nyo about Dinagat, destroyed houses, destroyed means of living, roads that are under repair, no electricity. By the way, there was no electricity in that area when we arrived, but we decided to stay in one place na may electricity, walang internet. So for a long time, we have to go to the operation center if you want to send something to the office or we want to connect with our family, but none at all in the areas where we were staying. Um, para sa taong sanay sa internet, it was a bit difficult during the first week. Pero nung bandang huli, kami-kami na lang ang nag-uusap, no? We were talking to each other like, sige, let's spend time with each other until the end. Believe it or not, we would every day, at the end of the day, sit until 9 o'clock sometimes. Nagchichismisan lang kami doon sa labas ng where I live, the house where I live. So, despite of what you saw, I said, kahit na sira-sira, kahit na marami ang problema, kahit marami ang sakit, ang ganda pa rin ang Dinagat. Yun lang ang masasabi ko. So next picture, this is my last slide. I think beautiful sunset. Every single day, sunset and sunrise in Dinagat is beautiful. So this is on a boat while going back to from Puerto Princesa to Dinagat Island. That's it. Thank you very much.